Welcome to the deep dive. Today, we're taking a deep dive into a topic that's seeing truly unprecedented awareness in Arvada in 2025: mental health care.
Hmm.
It's clear that more people than ever are seeking support, and our goal for you today is really to cut through the noise, look at the latest sources, and give you a crystal clear understanding.
Right.
We're talking services, costs, and your fundamental rights when it comes to mental health care right here.
That's exactly right. Our mission is to distill the most important nuggets of knowledge from our sources and really help you understand what truly matters in this evolving landscape.
Okay.
We'll explore the array of professional therapeutic support offered, typical costs, and the diverse payment options, and the crucial legal frameworks protecting patients in Arvada. What's truly fascinating, I think, is how these advancements and protections are empowering individuals, couples, and families to build lasting resilience.
Okay, so let's unpack this. If the first step is recognizing you might need support, the next big one is understanding what kind of support is actually out there. What's the landscape? What do the options look like in Arvada right now?
Well, the sources show a pretty comprehensive array of evidence-based treatments available.
Okay.
For instance, couples and marriage counseling. This is really focused on strengthening relationships
How does that work usually?
through improving communication and conflict resolution mainly. Licensed marriage counselors often use approaches like emotionally focused therapy or EFT.
EFT.
Yeah, which
Yeah.
helps couples identify and kind of reframe their emotional responses to deepen connection. Or they might use the Gottman method.
Ah, I've heard of that one.
Yes, it gives practical tools for conflict management, building friendship, basically addressing issues like trust and those communication breakdowns.
So specific proven methods for strengthening those key relationships. That's good to know. What about individual support for things many of us deal with, day to day?
Absolutely. For anxiety and depression support, therapists often combine multiple evidence-based approaches. It's about managing symptoms and improving quality of life.
Makes sense.
This commonly includes cognitive behavioral therapy, CBT,
CBT. Okay.
which helps you identify and change those unhelpful thinking patterns, and also mindfulness-based interventions, which teach, present moment awareness to cut down on stress.
Mm-hmm.
Then there's specialized trauma and PTSD treatment. This uses approaches like EMDR.
Eye movement desensitization and reprocessing.
Exactly, EMDR. It's a powerful technique that helps process traumatic memories. That's alongside things like trauma-focused CBT and somatic experiencing techniques.
Somatic, so focusing on the body.
Right, focusing on releasing physical tension related to trauma. The goal is creating safe environments for processing really difficult experiences.
And for anyone who's maybe felt their emotions getting the better of them, I saw there's also anger management therapy.
Yes, teaching healthy strategies using those same cognitive behavioral techniques. It helps identify triggers and develop effective coping mechanisms.
Got it. Okay, so that covers what kind of therapy. Now, for many people, the next hurdle after that is how do I actually access it, especially with busy lives? What's the deal with online therapy in Arvada? Is it really taking off?
Oh, definitely. Online therapy in Arvada is a significant development. It offers incredibly convenient, accessible care, right from home.
Right.
Licensed therapists provide secure video sessions, messaging support, things that truly fit into busy schedules while maintaining all the professional standards.
And privacy, people worry about that online.
Like, that's crucial to know. All virtual sessions fully comply with HIPAA privacy laws.
Yeah.
Those are the federal standards protecting your sensitive health information.
So it's secure.
Exactly. It ensures what you share in therapy stays strictly confidential.
That convenience sounds transformative for many, but okay, once you understand the services, the next natural hurdle for most is the money side.
The cost.
How do these various therapies typically cost in Arvada, and what can you expect with insurance coverage? Because that gets confusing fast.
It does, and that's such an important question. Costs can vary quite a bit,
Yeah.
depending on the therapy type.
Sure.
And factors like the therapist's experience level or specific specializations, those can also influence the fee.
Right.
So for individual therapy, sessions typically range from maybe $120 to $280.
Okay. And coverage.
Our sources show they're covered by about 90% of plans, which is pretty good. Typical copay might be $20 to $40.
90%, wow. Okay, what about for teens?
For teen counseling, it's around $110 to $250, covered by about 85% of plans, maybe a $20 to $35 copay.
Still pretty high coverage.
Yes, and even highly specialized individual therapies like ADHD therapy, that's like $120 to $270, with 80% coverage in trauma-focused therapy, $130 to $300, 85% coverage, they're surprisingly well covered too.
That's really helpful context for individual sessions. But what about supporting relationships like couples or even groups? How do those costs and coverage compare? That seemed lower before.
It often is, especially for couples. For couples counseling, the cost is around $150 to $350 per session.
Okay.
But the coverage is more limited. Only about 30% of plans cover it, our sources say.
Only 30%. Wow.
Yeah, and usually with higher copays, maybe $40 to $80.
Ouch. So that's more often out of pocket then.
It can be, but family therapy does better. It ranges from $140 to $300 and is covered by about 75% of plans.
75. Okay. That's more like it.
Right. And what's truly notable are the more affordable options. Group therapy is typically $40 to $80 per session.
Per person in the group.
Per person, yes. And it's covered by an impressive 95% of plans. Copays are usually low, like $10 to $25.
95%, that's huge for group work.
It really makes it accessible. And online therapy, again, highlighting its accessibility and, efficiency, ranges from $80 to $200 and is covered by 90% of plans, usually with a $15 to $35 copay.
Okay, so there's a wide range, but insurance doesn't always cover everything, especially couples therapy. Beyond just insurance, what does this all mean for actually making therapy affordable for everyone? Are there other pathways?
Absolutely, yes. There are many payment options. Most therapists accept major insurance plans: Blue Cross Blue Shield, Aetna, Cigna, United Healthcare, Medicaid.
The usual suspects.
Right. But if insurance isn't an option, or maybe your coverage is limited, many providers offer sliding scale fees.
Sliding scale, how does that work?
They're income-based reduced rates. So based on what you earn, the fee adjusts. Often they range somewhere from $50 to $120 per session. It's a critical safety net.
That accessibility for self-pay option is really key. Are there any common misconceptions people have about these alternatives, or maybe other ways to save if you're paying yourself?
Yeah, a common misconception is that self-pay just means a fixed high cost.
Yeah.
But actually, if you choose self-pay, you can often get maybe a 10–15% discount for paying in advance.
Oh, interesting, like prepaying.
Exactly. Or package deals for buying multiple sessions at once.
Okay.
And many therapists also offer student discounts, senior citizen discounts. It's always worth asking about those.
Good tip.
Flexible payment plans are also common things, like monthly installments.
Right.
And they usually accept HSA Brutus accounts.
Health savings or flexible spending accounts, right? Tax advantage money.
Precisely. And crucially, don't forget to check with your HR department about employee assistance programs, EAPs.
EAPs, right. Workplace benefits.
Yes. They often provide like 3 to 8 free therapy sessions through your employer. Many Arvada employers offer these, so definitely check that out.
That's a fantastic resource. Okay, so beyond the financial side, people often wonder about the commitment. How long does therapy typically last? Is it, a lifelong thing, or are there different durations?
It truly depends on your specific needs and goals. There's really no one-size-fits-all answer.
Right.
Short-term therapy is typically maybe 8 to 12 sessions, often focused on addressing acute anxiety or very specific recent issues.
Okay, like tackling one particular thing.
Exactly. Then there's medium-term therapy, usually around 12 to 24 sessions, common for managing depression or navigating relationship challenges. For more complex conditions, like long-standing trauma, long-term therapy could be 24-plus sessions, and it might extend longer depending on progress.
So it could be a year or more in some cases.
It could. And for ongoing support, some individuals opt for like monthly maintenance sessions once they've achieved their initial goals, just to kind of keep things on track.
That gives a great picture of the practicalities and how diverse the journey can be. It's not just one path. Now, let's connect this to the bigger picture. The legal framework and patient rights in Arvada in 2025. What protections are firmly in place for you as a patient? Because that's important too.
Absolutely critical. And there's been significant progress here. Arvada, being part of Colorado, fully adheres to federal mental health parity laws as of 2025.
Parity laws. What does that mean in practice?
It ensures mental health treatment receives the same insurance coverage as physical health services. So it explicitly eliminates discriminatory practices that historically limited access.
Like higher copays or fewer allowed visits just because it's mental health?
Exactly. Insurers must cover mental health care comparably to physical health care. This isn't just policy, it's a huge shift in access.
That really sounds like a game changer for so many people. What else is important from a legal standpoint that expands access? Any other recent changes?
Well, telehealth regulations have also expanded significantly in Arvada this year.
We talked about online therapy earlier.
Right. This means patients can now connect with licensed therapists through secure video platforms with full insurance coverage. It effectively increases accessibility to the therapy and also psychiatric care across the entire state.
Especially helpful for people maybe not right in the city or who have trouble traveling.
Precisely. For those in more remote areas or with mobility challenges, it's huge.
Okay. And when it comes to privacy, always a top concern for anyone considering therapy. What are the rules around patient confidentiality? How safe is that information?
It's very safe. Arvada maintains strict patient confidentiality under both federal HIPAA laws and robust state regulations.
Okay.
All therapy sessions are strictly confidential. Therapists can only share information with your explicit written consent.
Your written permission.
Yes. Or in very specific, legally defined circumstances involving imminent danger, like a serious threat to yourself or others.
Okay, very limited exceptions then.
Very limited. This robust framework is really designed to ensure your privacy and foster that safe, trusting therapeutic environment.
So with all these options, the insurance parity, the confidentiality, how do we know these therapists are actually qualified to provide such sensitive care? What are the checks?
That's a fair question. Licensing and professional standards in Arvada are rigorous, and that's by design.
Okay.
Therapists in Arvada must be licensed through the Colorado Department of Regulatory Agencies, or DORA.
DORA, right.
And getting that license requires not just a graduate degree, but also extensive supervised training, passing comprehensive exams, and, this is important, ongoing, continuing education to stay current.
So they have to keep learning.
They do. It ensures you're receiving care from highly qualified professionals upholding the highest standards of ethical and effective practice.
That makes the process feel much more secure. So, okay, given all these options, the legal framework, the qualified professionals, how can someone navigate finding the right therapist for them? Because that initial search can feel pretty daunting.
It really can. It's often the biggest initial hurdle, just figuring out where to start.
Yeah.
Fortunately, there are platforms specifically designed to simplify this, online directories and matching services.
What can you do on those?
Well, you can search by condition or specialty. So if you need help with anxiety or relationship issues or ADHD, you find experts with that relevant expertise.
Target your search.
Exactly. You can also filter by language, gender, cultural background, or session format, like in-person versus online. Things that help you find maximum comfort and fit.
That's really helpful for finding someone you connect with.
Critically, these platforms usually allow you to check reviews from other patients, see detailed pricing information up front, and get clear insurance compatibility details. It really empowers you to make informed decisions before you even schedule a first call or session.
That takes a lot of the guesswork out. Okay. So, as we wrap up this deep dive, it seems really clear that mental health care in Arvada in 2025 is, well, it's more accessible, more structured, and better supported than maybe ever before.
I think that's fair to say.
From the diverse therapy types we discussed to the comprehensive payment options and those robust patient rights, the landscape really seems designed to help you find the support you need rather than leaving you to figure it all out alone.
Indeed. And if we connect this to the bigger picture, the combination of increased public awareness, less stigma.
Definitely less stigma now.
Right. Plus the expanded and specialized services, those incredibly flexible payment solutions we talked about, and the strong legal protections. It all means that starting your therapy journey has never been more within reach. It feels like a moment where personal well-being isn't just encouraged, but it's actively prioritized and supported by a pretty robust system now.
And that's something worth exploring for anyone listening. As you consider your own journey, or maybe that of someone you care about, remember this vast and varied network of resources that's now available. What stands out to you, just as a final thought, about how these options might fundamentally reshape mental health support, maybe moving beyond just treating problems towards something more like proactive, personalized well-being?